Hi, I'm Dr. Ed Jacobs here with Dr. Chris Schimmel, and we teach at West Virginia University, and we do workshops around the country on impact therapy. And one of the main tools or techniques that we use in impact therapy is the small chair. And we're going to talk about the small chair here in a couple of minutes. Impact therapy is an active, multisensory, creative approach to counseling. And Chris, I guess let's just talk about the small chair. I mean, we could talk about all these other things, but
okay.
What are you use it a lot? I mean,
well, the small chair really comes out of a concept of transactional analysis when you're referring and you're wanting a client to understand their child ego state. But what I've found is so powerful about the small chair is you don't have to teach transactional analysis. That clients, a majority of the time, when you simply pull the chair out and say, that sounds like your little girl part, or that sounds like the part of you that's very insecure, they understand that and they relate to it, and having that visual there so enhances the client's experience and heightens their awareness, really. I think in impact therapy we write about it heightens their awareness to the fact that this part exists in them and that sometimes they get in that seat and they function from it.
Yeah, the small chair and the whiteboard are the two props that I use the most in my counseling. And I have clients come in and say, I hate that small chair. And I say, I know, that's the problem. We got to get rid of the small chair. Or you know, or just all the different times where people get in the chair, or that time, the first time you used it.
Yeah, it makes me always want to tell the story that the first time I ever used it in a session by myself, I'd done a lot of co-counseling with Ed, but the first time I ever used the small chair by myself was with an older gentleman who was having some issues meeting women and dating and some insecurity. And I thought, it really sounds like his child ego state gets involved when he meets a woman. So I pulled the chair up and I said, Ted, why don't you sit in this seat and slide over here? And the minute he hit that seat, he broke into tears. He was just saying, this is exactly what I do when I meet a woman. I'm insecure and I don't like myself and I think she's not going to like me. And I just remember having the experience of sitting there watching this and going, oh wow, this really works. It's a very powerful tool. And just then being able to focus on that and helping him do what we call get back in his adult about meeting women, and just a very powerful tool.
Yeah, and but a lot of our students and people say, do they ever feel humiliated? But one of the things in impact therapy is timing, and we sort of know when to do it, and we've got good rapport, and we pull that chair up.
Yeah, and it's never used
to humiliate. Yeah, like putting in a big baby.
Yeah, no, it's never used in that manner or that tone of voice. It's always like, I think sometimes you do this.
And the other value of impact therapy makes counseling concrete. The small chair makes it concrete, where if you've got another chair like this, and say you have a choice of being in the big seat or the little seat, and we do that all the time, right?
Right.
And that just makes such a difference. Yeah. So
the other thing that people get sort of hung up on too, or it becomes a block for them, is they think that you can't use the small chair with a younger child, with a third grader or a fourth grader. And I, as a school counselor, would do that all the time, because kids would get in this seat in their classroom and get in trouble and act out. And
time out is really
trying to teach a child to get in their thinking seat. Go to this seat and think. So explaining that to a child and saying, let's get you in your thinking part, it can be very effective.
And the concreteness of it, and the idea they have a choice of being in this seat or that seat. I remember doing that with a 9-year-old, and at the end of the session I asked him what stood out. He says, I got to get out of that seat and get more into that seat. For more information about impact therapy, go to impacttherapy.com.